Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. This week, the nation celebrated receipt of additional Sinopharm vaccine doses, as well as receipt of the very first consignment of Sinovac vaccine doses from China. The nation was also pleased to learn about the positive results of a February 2021 survey conducted by PERC, which is a team of global scientists that includes the WHO and the Africa CDC. The survey results specifically and clearly demonstrated that over 60% of our people plan to get a vaccine when it is made available. Now that we have two types of vaccines on the ground, a number of people have asked which of the two they should have. They have also asked if they should wait for the other types of vaccines that we've talked about from China, Russia, or the UK, for example. My update today is going to address these issues. But first, let us quickly review our COVID-19 statistics for this week as usual. As of yesterday, Thursday, the 18th of March 2021, Zimbabwe's cumulative number of COVID-19 cases was over 36,611, with over 34,226 recoveries and 1,509 deaths. Currently, Harare Metropolitan Province has the highest COVID-19 incidence per capita, followed by Bulawayo and Matabeleland South provinces. Vaccination of frontline workers continued in designated vaccination sites in all our provinces throughout the week. As of yesterday, the cumulative number of those vaccinated was over 40,000. That is a very good number. Let us now address those important issues that came up during the week. Specifically, which vaccine should one choose? And should one wait for other types of vaccines still to come? In other words, which is the best vaccine to have? It is important to remind ourselves that all authorized vaccines, including the Sinopharm and Sinovac vaccines that we received this week, work extremely well to protect against severe disease, against hospitalization and death. All authorized vaccines have gone through the required clinical trials as well as the necessary regulatory clearance processes by our Medicines Control Authority of Zimbabwe. What is left for the vaccine to work, for it to be the best, is for that vaccine to be injected into individuals' arms. Experts globally and here in Zimbabwe have made it very clear that the best vaccine is the one that an individual has received, and not the one that is sitting in our central vaccine stores or sitting with the manufacturer in China, America, UK, or anywhere else for that matter. Remember that as long as we still have COVID-19 cases, as long as we're recording cases, transmission of the virus can suddenly go up once again at any time, as it did towards the end of our first wave. If this happens, and if at that time you have not been vaccinated, it means you have a higher chance than those who have been vaccinated of not only contracting the disease, but of also getting the severe form of that disease that requires hospitalization, that can in fact lead to death. Our January 2021 experience is a lesson we should never forget, but we must learn from it. Let's protect ourselves. Once again, all authorized vaccines here work to protect against severe disease, hospitalization, and death. Receiving a vaccine now is therefore better than waiting to receive a different vaccine later. In other words, the approved vaccine that you can get now, whether it's the Sinopharm or the Sinovac, it doesn't really matter which one, that vaccine is the best vaccine for you. These vaccines are safe and effective. Talking about effectiveness, the vaccines that the Medicines Control Authority of Zimbabwe have approved, including these two for use, have all had the are therefore effective. If we come to the safety of these vaccines, well, these vaccines, like most medicines, can cause some short-term side effects in some people, including pain at the injection site, fatigue, headache, as well as muscle and joint pain. These short-term side effects are, a number of cases, are a sign that your immune system is kicking into action and producing those antibodies or soldiers that in turn protect you from the deadly COVID-19 disease. These short-term side effects, therefore, do not mean the vaccines are not safe. These vaccines are safe according to the current science. This week, the delivery of the additional vaccine doses took our vaccination program to a much higher level, and we are truly excited about it. We have the vaccines and the people want to be vaccinated, as confirmed by the recent scientific survey. Let us therefore roll up our sleeves and get to work. For those who have received their first vaccine dose, do remember to get your second dose when the time comes. In the meantime, you must continue with all the other preventative measures now and even after you have received the second dose. For those who have not yet been vaccinated but are eagerly waiting and planning to be vaccinated, do get vaccinated when your chance comes. And yes, we will let you know about it. In the meantime, you too must continue washing your hands with soap and running water. Please sanitize your hands with alcohol-based sanitizers and social distance. Don't get into those big crowds. Do continue wearing your face mask and do it properly. Thank you.